Hello, thank you for joining us for Unite for Sight's webinar about tools for effective research, monitoring, and evaluation. Today we have more than 500 participants, and we are thrilled to have all of you here today. My name is Jennifer Staple-Clark, and I'm founder and chief executive officer of Unite for Sight. I'll start by briefly introducing Unite for Sight, then we'll review the webinar logistics, and then we will hear from our 6 expert panelists. Unite for Sight is a global health nonprofit organization that promotes high-quality care for all, and we offer extensive global health and social entrepreneurship education programs, including today's webinar, which is part of Unite for Sight's Global Health University program, and we have a number of other webinars throughout the months as well, including December 9th, we have an upcoming webinar about research and advocacy to curb the health impacts of environmental contaminants, as well as 2 scheduled webinars in January about making the most of an international experience, as well as learning from innovation experts. And all of those details are on our website at uniteforsight.org/webinars. We also offer additional online certificate programs, 20 online certificate programs for students and professionals, and many students receive academic credit for completion of our certificate programs, and many professionals pursue these certificate programs for professional development. And the certificate topics range from a certificate in global health and a certificate in global health research to a certificate in social entrepreneurship. Additional educational opportunities for students and professionals include participation in Unite for Sight's annual Global Health and Innovation Conference. And our 3rd annual conference is upcoming on April 16th and 17th, 2016 at Yale University. So definitely save the date, and complete details, including abstract submissions and registration, can be seen at uniteforsight.org/conference. And a number of our panelists today are additionally speaking and sharing their expertise during the conference as well. We also have healthcare delivery programs that provide care to patients living in extreme poverty. And we partner with phenomenal local eye clinics in India to provide quality eye care to patients who are otherwise unable to access or afford care. And these programs are locally led and managed by the local medical professionals. And this collaboration provided eye care to more than 2 million people by the local doctors during the past decade, including more than 93,000 sight-restoring surgeries by the local ophthalmologist. Unite for Sight is the world's only organization that is a healthcare delivery organization that also offers immersive global health education and social entrepreneurship opportunities for students and professionals. Participants support and learn from the local doctors in Ghana, Honduras, India, as they provide care to patients living in poverty in villages, slums, and refugee camps. And the participants learn from those local medical professionals about patient barriers to care and about effective strategies to reach the hardest to reach patients who are otherwise unable to access or afford care. And the local doctors are incredible social entrepreneurs who design effective and innovative strategies to eliminate patient barriers to care. Now I'll describe the basic logistics of this webinar. We're thrilled to have all of you with us here today. We have 6 incredible panelists who have a wealth of expertise to share with you during this next hour. Each of the 6 panelists will begin by giving a 2-minute introduction about themselves, their current role, and their key lesson learned about research, monitoring, and evaluation. And then we'll dedicate the remaining time to your questions and answers. And we received many stellar questions already in advance by Monday's question submission deadline, and we selected the most common and most thoughtful questions to ask our panelists. We also invite you to additionally submit questions today in the text box on the left of your webinar screen, and then we'll select additional questions to ask the panelists today as well. We also encourage you to tweet about the webinar, including your key lessons learned, by using the hashtag GHEWebinar, and you can see that hashtag in the webinar visuals on your screen. So now we will proceed with having our 6 panelists introduce themselves in alphabetical order, and I'm delighted to introduce our first panelist, Juan-Carlos Alegre. If you could please begin by introducing yourself, your background and current role, and please also share your key guidance regarding research, monitoring, and evaluation.
Thank you, Jennifer, and hello, everyone. My name is Juan-Carlos Alegre, and I lead the Performance, Learning, and Impact Unit at Management Sciences for Health. This is the unit that provides guidance, standards, policies related to monitoring and evaluation, implementation, research, organizational learning for all projects implemented by MSH, Management Sciences for Health. Our organization focuses on strengthening health systems. We're currently working in close to 40 countries in sub-Saharan Africa, Asia, and Latin America. My academic background is in operations research and the use of scientific methods for systems optimization and improvement. And for the past almost 25 years or so, I have applied my academic and professional background in the field of monitoring, as well as evaluation and applied research, primarily in global health programs and initiatives. And if someone asked me about the key lessons learned about effective tools for research or M&E, my immediate response would be that there is no silver bullet when it comes to tools in the field of M&E or applied research, as in most of the projects that I have been involved with and working with and supporting and managing, context matters a lot. So I would rather focus on principles rather than tools, principles that promote the use of the evidence for decision-making, or principles that calls for developing strong research questions which should inform the most appropriate methodology for study implementation, or principles that facilitate the development of what I would like to refer to as an evaluative thinking culture, principles that promote the most appropriate methodologies that minimize bias, or principles that maximize ethical approaches and do no harm principle for every data collection inquiry that you conduct.
Excellent. Thank you so much. And Liz Chamberlain, if you can also please introduce yourself and also share your key piece of guidance regarding research monitoring and evaluation.
Sure. Thanks, Jennifer. Hi, everyone. I am Liz Chamberlain. I'm the Impacts Manager at Lwala Community Alliance, which is a health and development agency based in rural Kenya. So I work really closely with our Kenyan team to gather, manage, and analyze data to improve our program performance, and then also to share our results with external audiences, both in Kenya and around the world. I look at both programmatic and financial data to help us as an organization understand what the impact of our project is, and also how cost effectively we're doing our project. So I have a graduate degree in international development and economics from Johns Hopkins University. And professionally, I've spent time working at the World Bank doing research and at several NGOs carrying out international program management. I've lived for a few years in both West and East Africa and love them both. I will share a lesson right now for, I guess I'm going to say it's for grassroots organizations, but maybe it's applicable across the board, and it's a little bit similar to Juan-Carlos in that it's not specifically a tool, but again, more of a principle. And that is simply just the lesson is that it's important to plan ahead with research and with monitoring and evaluation strategies. So for grassroots organizations, I would recommend when you're still in your infancy that the startup team identifies the long-term goals of the organization and basically works backwards to develop a set of indicators or maybe a research question that can show how you are meeting your goals. And I think having a strong set of indicators at the start can really guide the team in terms of how you collect and manage your data and thinking about the right research methodologies. And it may sound a bit obvious to plan ahead, but I think for a lot of NGOs that work in rural areas that can be particularly challenging and places that may be understaffed, time and effort will often go towards the implementation of programs and projects rather than understanding how to measure the success of your programs later on. And I think that will create a challenge later on when you are trying to prove the success of your programs or just to understand the success of your programs. Thank you.
Terrific. Thank you so much, Liz. And Michael Gyasi, please introduce yourself as well.
Hi, Jennifer. Thank you so much for having me here. I'm excited to be part of this web conference and look forward to exchanging ideas, sharing my experiences, and engaging with all of you, both on the panel and in the audience. I'm a practicing ophthalmologist with master's degree from University of London in community health. I'm from Ghana, and as expected, a greater part of my work has been the area of clinical care, where 85 of us provide care for a population of 26 million. This underscores the enormity of work I have to do on a daily basis, weekly basis, and on a monthly basis. In spite of all this, however, I still manage to find time to do some research work, and most of my work have focused on improving the healthcare delivery system in Ghana, with special emphasis on eye care. We study into barriers to service uptake, expansion, and analyze intervention outcomes, and seeing to it, importantly, that these findings are implemented. In other words, most of the works I do are in the domain of operational research. My advice to all of the audience out there regarding effective tools, effective research, especially developing this setting, is that these are more feasible if you have access to resources. You need resources at every stage of the research process, from designing, from implementation, monitoring, and evaluation. And this becomes especially important when it comes to implementing the research findings. After all, we ought to know that your research has a value only if the findings are implemented. I look forward to interactive discussion with all of you, Juan-Carlos, Ms. Chamberlain, Lisa Hirschhorn, Kalameta, and Jordan Levy. Thank you so much for having me here.
Wonderful. Thank you so much, Michael. And Lisa Hirschhorn, please introduce yourself as well.
Sure. My name is Lisa Hirschhorn, and I work for Ariadne Labs, which is a partnership between the Harvard School of Public Health and the Brigham and Women's Hospital in Boston, Massachusetts. Currently, I am the director of the Implementation Science and Improvement Platform at Ariadne Labs, which is actually a health systems improvement innovation space where we aim to create scalable healthcare solutions that produce better care at the most critical moments in people's lives everywhere. We started with the safe surgical checklist, have now moved into other critical moments such as birth, death, and actually primary care, as well as some other interventions. My background, I was originally trained as an HIV clinician and spent the first 2 decades or so, starting in the pre-treatment era in the United States, and then as treatment became available, became very involved in the global scale-up of treatment options, and was very interested in how we measure and how we improve quality, and have spent the last 15 years or so of my life helping to evolve monitoring and evaluation to understand the overlap with that in implementation research and quality improvement so that we make data work hard and we're more effective in the measurement and the improvement and sharing of knowledge. In terms of key lesson that's learned about effective tools for research monitoring and evaluation, some of them have already been stated by my other co-panelists, things like spending time planning and context really matters. And so I would just add 2. The first is know at the end, know what you want to do with your data and your information at the end. So I start on the right-hand side of a logic model and say, what should success look like, and what am I going to do with this information, and how am I going to actually use it to either improve knowledge or improve care? And then the second is to respect all manners of methodologies, qualitative, quantitative, things in between, but also recognize how much evidence do you need and how much rigor do you need, and tailor that appropriate to the goals that you have for your data collection.
Terrific. Thank you so much, Lisa. And Jordan Levy, please also introduce yourself.
Thanks, Jennifer. Also appreciate being on this webinar and interacting with these incredible panelists, as well as all the audience and these very interesting questions. My name is Jordan Levy, and I work for an organization called Ubuntu Education Fund. Ubuntu is a grassroots organization based in the townships of Port Elizabeth, South Africa, and we work with children and their families, normally orphaned and vulnerable children, as we say, from cradle to career. And our approach really prioritizes the depth of the impact that we can have on these children and their families and the community over the amount of children that we can reach. And I think this strongly influences our approach to monitoring and evaluation. As far as my role, I'm currently the Chief External Relations Officer, which has a lot to do with fundraising and partnerships and marketing. However, I spent 11 years on the ground with Ubuntu from the very early years of the organization, building out the systems and what we currently call the Ubuntu model, which is our approach to working with orphans and vulnerable children. However, integrated into that very strongly, of course, is monitoring and evaluation. And I have a lot of experience with slowly developing early systems. Some of my fellow panelists already spoke about starting early and trying to understand things at a very early stage. I wish that I had this webinar about 10 years ago for myself because we didn't really know what we were doing at the beginning. And that's an interesting place to start, and you learn a lot that way. We have to figure it out, trial and error, and some of the biggest mistakes informed the way we ended up going, which I think has ended up being highly successful. But the key lessons are many. I'll talk a bit about process, and I agree with my fellow panelists that principles are probably the most helpful on a call like this, or the time we have to talk about, rather than tools, because they can guide you to a successful approach where many different tools could end up fitting based on your context. But the things that I would mention are you need to integrate monitoring and evaluation into your organizational culture. You have to make sure that people on your team and even your beneficiaries to some extent understand what the monitoring evaluation is and what its purpose is. If you've clearly outlined where you want to be at the end, does your team understand where you're trying to go? You don't want to end up just passing data up a ladder, because what happens then is people are part of that process, but they don't know actually what they're touching as they pass it up. And in order to do that, what I recommend is showing your final results internally. And what I mean by that is a mechanism we used at Ubuntu or use at Ubuntu. It's something we call milestone meetings. They're very simple. Quarterly, we meet as a whole staff, and we take key data and analysis from each department, and we present it internally and talk about it so that people can say, oh, those number of HIV tests I was counseling or counting and entering into this data system added up to an understanding of X impact. Oh, that's what I'm contributing to. And this is key because one of the key questions I think that a lot of your team members are going to ask is, what am I a part of? Obviously, on some macro level, I understand the mission and all of that. But when it comes to monitoring and evaluation, it's extraordinarily helpful for getting your team bought in and making them realize the overall impact that they're contributing to, and gets people to ask why. And I think if M&E is working, it's going to end up driving change within your organization. It can actually be an excellent tool for those of you who are managers and looking at change management within your organization. If your team is fully embedded early in the M&E process, by the time you get around to changing things, changing your approach based on things that work or didn't work, everyone in the organization is going to understand based on the data presented and be more open to change.
Excellent. Thank you so much, Jordan. And Kala Mehta, if you can also please introduce yourself.
Yes, good day. First, I'd like to thank you, Jennifer, and your team at Unite for Sight for the opportunity to join this esteemed panel. By way of introduction, I'm currently an assistant professor in the Department of Epidemiology and Biostatistics at the University of California, San Francisco. I'm really passionate about the intersection of social entrepreneurship and global health. So this panel is quite appropriate. I'm particularly emphasizing how to deliver better care to rural villages in or low to middle income country context. Something else that I work on currently is really building research capacity. And towards that end, I teach clinical research methodology to medical students, residents, fellows, and international faculty using online educational technology. Prior to this, I was a faculty affiliate at the Global Supply Chain Research Forum at Stanford Graduate School of Business. And there I was lucky to be involved with an interdisciplinary team where we tested the Riders for Health systematic transportation model over 2.5 years in southern Zambia. And I'm very happy to report that the results were published last week in the American Journal of Public Health. Check it out. You asked about key lessons, and I have to agree and echo the esteemed panelists that came before me in terms of thinking about principles, also to really plan ahead and also, figure out in advance how you're going to use that information. And I'd like to add one more principle to that, and that is to truly work as equal partners with your in-country leadership at the formulation stage and also all the way through. I think global health work can be viewed as a team sport, and all members of the team have a unique perspective and something equal to contribute. For my own work, I have tremendous respect for our 9-person team in Zambia. I learned a lot from them about what the research meant, how it was going to be implemented, and what the monitoring and evaluation could eventually do. So I'll leave it there. Thank you so much.
Fabulous. Thank you so much, Kala. And thank you to all of our panelists. As you heard, they have a phenomenal wealth of expertise and guidance to share with you today. Now we will proceed with the question and answer session. And as mentioned previously, we received questions in advance from you, our audience members. But if you have additional questions, please post them in the text box on the left of your webinar screen, and we will include those questions in our queue today as well. To begin, Jordan, for our first question from the audience, how do you introduce research, monitoring, and evaluation in an organization that has never used evidence-based techniques before? How do you share the value of this work and prove its worth for the organization?
Well, I hope I didn't give too much away in my overview, because the principles are very similar that I expressed in the overview to my answer to this question. But to elaborate a bit, I think it's about buy-in and ownership. It's about looking at an organization at its stage and understanding the team and what they are going to be able to truly comprehend in terms of what that evidence-based research and monitoring and evaluation and how it can add value to their work. I think one of the things about organizations on the ground and my background running a very small organization at the beginning, a real grassroots type intervention, is that time is limited. And at the end of the day, those people who are out in a community, let's say, implementing, key health education, psychosocial interventions, are busy people who are under a lot of stress for the most part. And when you start talking about this concept of monitoring and evaluation and research, it can seem like an added responsibility. It can seem like, we'll get to that when we get to the next stage. That's what bigger organizations do. However, what has to be understood is that's how organizations get bigger. That's how organizations get better and how you get more effective. But that has to be bought into, and that has to be something that is part of an actual culture where the team members themselves are driving this, because we're sitting around and we're saying, hey, what would be a more effective way to have a bigger impact? What is a more effective way to do our work and maybe even cut down on the workload by analyzing it, as opposed to, when I'm done with all my work, then I have to stay later and do this research or this monitoring evaluation, because the clean separation, when you get to another level of teams, when you have enough money and capacity to build out a separate M&E department, usually comes a little bit later. But even when you first do that, feeding that data into the M&E department is a little bit of an added responsibility. So, again, it's creating systems within your organization where you present back what that monitoring and evaluation and what that data actually did for you, how it improved the work, and how it relates to individual job responsibilities, so that each team member can connect to the bigger picture and truly understand in context the value of this work. And I think if you do that as sort of a principle and a process, you're going to have more success integrating it into an organization that may not have experience with it previously.
Excellent. Thank you, Jordan. And Juan-Carlos, how have you seen monitoring and evaluation develop during the past decade, and where do you see the field in 10 years from now?
Well, I've seen the field of M&E evolving significantly, I would say, over the past decade, primarily because we have seen quite an evolution from focusing on accountability to what I would say is still a nascent and emerging learning dimension. However, this addition has begun to be reflected in the way we develop M&E systems for different projects or initiatives, and also in the way we structure units or departments that incorporate learning into M&E and research. And there's still a long way to go. But from the perspective of many stakeholders, I would say there's a need to foster, support, and develop learning approaches that need to be facilitated by learning environments that can promote safe spaces to which key actors, whether these are implementers or donors or local stakeholders, in-country partners, the community, and others, can learn from successes, but also, as important from the challenges and failures that we have and that we face. And while we need to acknowledge the emerging contribution that technology brings to the field of M&E and research nowadays, we need to learn how to best apply those technological advances that can facilitate what I call behavioral platforms, which are, to me, are the key ingredient for systematic learning. So we can continuously improve how we deliver those evidence-based interventions in the field of global health that save lives and improve health.
Terrific. Thank you so much, Juan-Carlos. And Jordan, what advice do you have for a smaller organization without many resources for assessment, and how should a program's budget be allocated to monitoring and evaluation?
Sure. Well, I think you need to allocate real money towards it. But just to say that simply is much easier said than done. So what secrets have we found towards being able to allocate real budget towards it? That's really being transparent, and so much so that you need to build it into your fundraising. I think when we all launch out there, and this goes to a bigger overhead debate and things like that are out there, this overhead myth that I'm so glad was commented on recently, for example, by the Ford Foundation, is all built into this. Monitoring and evaluation, things that are quote-unquote administrative, are not your little secret burden that you have to, take home at night in a guilty way. These are things that you need to run your organization effectively, to run your program effectively, and to do the work well. So yell it from the rooftops, share it with your board members, share it with your biggest supporters, and try to find a way to do it that gets them to buy in. But be very transparent from the beginning that you need these resources and that you'd like to allocate a decent amount of money to it as early as possible. And that's how I think you can allocate a significant percentage of your budget towards it. As far as doing it well at an early stage, I believe the key is to connect to those that have already done it. As we can see by the panelists here, there are an incredible amount of resources out there and people who, if you ask them, will share a little bit of their time with you and their advice. There's also online tools out there. There's some great websites out there, whether you're looking at your DevX's or others, where you can start researching who might be looking to share already established tools or somebody that you can connect to and pick their brain. Don't feel like you have to develop that system in isolation. Don't feel like it has to be a quiet after-hours process that you hide from the world. It is something you need to be out front of. You need to be transparent about. You need to talk to your board about it. You need to fundraise for it, and you got to spend money on it.
Terrific. Thank you, Jordan. And Liz, in what ways have your programs included the voices of the communities you serve in the development, monitoring, and evaluation of interventions?
Yeah, thanks, Jennifer. So this idea of participatory development is one of the core values at Lwala Community Alliance. This idea that the community that is being served is actually part of the process in identifying the problems and solutions and is able to play a role in executing the plans. So for an example, our education team, we have 4 major teams at Lwala focused on clinical care, public health, economic development, and education. And this team works with youth in schools through after school and holiday programs. We provide uniforms and sanitary towels to girls. We support youth in getting into secondary school. And all of these activities that I just mentioned were born out of months of focus group discussions with key stakeholders in our community. So these included parents, students, teachers, the local government, sort of anyone who was involved in the school setting. And this program was a little bit unique because it was so focused on getting the voice of the community. But we do try to do that in everything. We have a hospital actually that was built because the community was, on board and asking for it. It was in a very rural area that didn't have anything before. So I think if you ask and you create a venue for allowing people to participate, it's very easy in terms of program development. Now on the M&E side, we try to as well incorporate the community as much as possible. So we carry out a lot of surveys and focus groups, and we do these with both program participants as well as the community at large. So for a few examples, we carry out patient satisfaction surveys at our hospital to give some voice to patients on how they're being served and what we can do better. We also will do focus group discussions with the girls who receive sanitary towels to ensure that the actual product is designed well. We also have community-wide meetings where anyone is really allowed to attend, where we just get to have open discussions, and those discussions often help us identify where we need to improve our programs, change our programs, and can identify the community's needs. We're a bit unique because we are focused in one specific community and region, so we have the opportunity to really be involved with the community every day and get feedback from them. But this year we actually carried out our first annual survey where we interviewed a sample of 500 households to get information, opinion, and suggestions, and it was a random sample of the population that we serve. And that is one tool that we hope to continue in the future, because we feel that it can be very biased when you're collecting data just from program participants. First of all, they're benefiting from possibly the services that you are providing, but they also may have a biased view of your organization. And so we felt it was important to get less biased view by interviewing the entire community randomly, and using that data to, first of all, help us get some more information about that community, but also ensure that people's voices are heard who aren't always heard through normal program.
Excellent. Thank you, Liz. And Michael, when students or faculty wish to engage in research in communities other than their own, how do you suggest that they approach the establishment of a collaborative research process?
Thank you, Jennifer. I think there are a number of ways, at least. We can look at probably 3 or 4 ways that this can be done. Thanks to technology, it's not too difficult these days to identify a collaborator through an online search. So the first way probably is individual-to-individual contact, direct communication. But this, however, works better if it goes through a third-party collaborator. Like, for instance, Unite for Sight as an organization has been doing well in this area where it matches researchers, local partners with Unite for Sight volunteers or students who have certain research interests are usually partnered together and they work together. Right. The other way that this can be done is through teaching hospital collaboration. In other words, when the prospective researcher is somehow introduced by a teaching hospital to another teaching hospital where they can now partner and work together. A third one in Ghana is actually going directly to the Ghana Health Service website and applying directly to the research department for this kind of thing. And the fourth one is through independent tertiary research institutions, and there's a large facility in Ghana which has been doing this. It's mainly set up for virology research, and it's expanded into other areas. However, I think the most important thing in this regard is what Carla said earlier on in her introduction, and that is working with local collaborators as equal partners. I think this is important, right? And the other thing is what Liz has just mentioned, getting the community's involvement in identifying their needs and the overall program development. Now, let's put this into the Ghana context. A research proposal, in my view, should be directed at addressing a specific local needs. And this is important. It's not just coming to do research, but see to it that the proposed research actually has impact on local communities. It addresses their needs and impacts a kind of skill set or technology to the local people to move on or to solve their problems. And the other thing that prospective researchers would need to know is the ethical issues. Ethical approval is mandatory in Ghana for all human-based researchers, right? And this takes a lot of time. It could take more than 1 year. And my own research at the master's level, actually, I finished that way before I got approval. So these are constraints that you find in developing countries, and people have to bear this in mind. What we have found useful in some of the research collaborations we've done is to get a prospective student or researcher to seek a local IRB approval. Once that is done, it makes things easy compared to coming to start all over and waiting for a period of 1 year or more to get approval. And in addition to this, however, is also the fact that the longest period that you can have approval is when you go to the Ghana Health Service. In other words, the Ministry of Health. It seems to be from experience that teaching hospitals are likely to give approval much earlier, and research institutions are much likely to give approval much earlier than going through the Ghana Health Service. So these are some of the things that people have to bear in mind. So in summary, the important thing is that people should not just focus on coming to do research, but should focus on the research that has local content and addresses local needs. Thank you so much.
Terrific. Thank you so much, Michael. And another question for you, Michael. What is an example of an ethically troublesome research process, and how could it have been improved?
I think there are a number of issues. When you talk about ethically problematic or troublesome studies, I think the first thing that comes into mind is from history. I think in the United States here, we know very well the Tuskegee research, the syphilis trial that went on for about 40 years. Right. This is a classical example of ethically troublesome study. And when we look back a few years, probably 20 years, that's not too far in the past, is the Pfizer meningitis trial that happened in Nigeria. It had ethical issues. But then let's now look at Ghana, where I live, and probably put this in context. In 2001, a laser tube was developed. That was the first time Iridex was developing the laser tube. It was never tried anywhere, never tried in the United States here, never tried in any Western country. That device was carried all the way to Accra, incidentally the hospital where I work, where the first laser trial was done on people with common primary open-angle glaucoma. Now, the current indications for these two haven't changed from what we knew 20 years ago. It's used in a specific type of glaucoma. However, this trial focused on using this tool in a normal, uncomplicated glaucoma. Incidentally, the authors managed to publish it and declared that the research was successful and recommended that it should be used, the tool should be used in Black African populations with glaucoma. Up to this day, there hasn't been similar studies that recommend this, and this is a major issue. 2013, there was again a new tool, a new device that was developed in India for glaucoma. I happen to be the technical advisor to the ethical committee that looked into this tool. Every online search in the use of this tool showed clearly it had not been tested anywhere. In India, where the device was developed, had applied for a clinical trial, phase 3, and yet this device was already in Ghana for studies. Now, what are the ethical issues that come out in the study? It was to do with issue of compensation, issue of local content, and the price of the device. In all researches, you expect that there will be some complications, and there should be a way of compensating for this complication. The proposal which was sent stated clearly that we do not expect any complications, even though it's clear that some people will permanently go blind. There was no compensation assigned to people who go blind for the use of this new device, which was untested. The other issue was to do with local content. It was stated clearly that the research will impact skill set and knowledge to local doctors for them to be able to carry on. Yet there was no strategy how to get local doctors to participate in that research. And it's run for 2 years and no single local doctor has been invited to join that research. Contrarily, surgeons have flown all the way from the United States in a kind of parachute research. This one comes, he goes, another one comes, and another one comes, and another one comes. These are ethically troublesome studies where essentially the local population is used mainly for the research with no benefit whatsoever in that regard. Now they talk about the price of the device, that it will come down to $11. The current one with a bivalve is about $500. So the aim is that with this new device, the price will come down to $11. Now the device is already out, even though phase 3 hasn't completed, and it's going for about $200. So in all we are saying is this: when you have these kind of researches, it actually shortchanges the local community, and there's no benefit whatsoever that probably we can see inside. And these are some of the troublesome research ethically. Thank you.
Wonderful. Thank you so much, Michael. And Lisa, there is concern that many published research findings are not accurate. John Ioannidis' article in Public Library of Science, for example, elucidates many of the common issues that lead to inaccurate research results. What are basic steps that you suggest that all researchers pursue so as to help ensure the accuracy of the data collection? And how should the research community improve the overall research process to ensure that studies are accurate?
So thank you. This is a really excellent question. I really want to thank whoever is that submitted it. So for people who haven't actually read this article, it's a very good article, although I think is perhaps takes a little bit of a mixes up a little bit things that have to do with both methodology, issues around contextual factors, and and replication. And so I think what this talks about is, first of all, that you need to be sure that the methodology that you are using is the appropriate one. And so if you want to do something where you want to actually show impact, you need to design something so that you're actually able to say, we know we actually have attribution, we can actually do that, and it is significant. And statistically significant is traditionally used at a p less than 0.05 value, and that has both positives and negatives. So it doesn't mean that you've proven anything. It says that there's a very good chance, 95% chance, that what you saw wasn't from chance alone. Now, that only works if you actually only look at one outcome. If you look at 100 outcomes, simply by chance alone, 5 of them are going to actually be true, are going to come up as statistically significant, whether or not it's really true or not. And the flip side of that is that if you want to prove that something doesn't work or that there isn't a difference, you need to be very careful, and instead of thinking about things like statistical significance, you also need to think of something called power, which is basically saying how many people did you need to be able to measure, or facilities, or outcomes, to be able to know that I have a good amount of certainty to say that there is no real difference. And I would say for all of these things, make sure that you have somebody who knows what they're doing, who's advising you. Now, that doesn't mean that just because something has been shown to be true or statistically significant in a study, and then you go and you try to replicate it, and it doesn't work, that the original research findings weren't true. It really has to do with, again, it goes back to one of the first lessons learned, which is about context matters. So if you're taking something, and a great example again from other questions that have been asked about, for example, survey questions, is if you take something and you choose the best place in the world to test it. It has a fantastic leader, all the resources are there, people are very excited, they're well trained, there's enough people, and it works. It actually does work in that setting. That's true. If, however, you think that, well, that means that you can actually generalize that to every place, you're probably going to be wrong. And there's some very good research in implementation science which basically says, look, you need to go in there and you need to do this kind of formative work to understand what are the contextual factors that you think are the most important, how do you need to adapt what it is that you actually want to do, and is what you want to do actually even appropriate? And then you need to adapt it, and then you need to test it, and then you need to change it as needed, and then go into more formalized testing. And that's this concept of sort of adaptive trial design and research, and in management, adaptive management, which is you sort of always taking in new information, I think is really critical. So long-winded answer to the idea is that you need to make sure your methodology is correct and is appropriate, that you're not fishing in the data and therefore asking too many questions so that chance alone is going to give you a yes answer, that you have enough power to be able to know if you're going to say something doesn't work. And incredibly importantly, and this is the gap that I spend most of my life in, which is how come when we find something works in research, it doesn't work in real life? How do we actually then use rigorous enough measures to understand how to adapt something to make sure that it works within the local context? And it, again, really reflects on all the feedback that you've gotten so far about involving the community, measuring context, field testing things to be able to really understand that, being humble about the knowledge that you have coming in, and then being able to adapt as you go along. And this is one of the arguments why if you're going to do a randomized controlled trial, that it still may not give you the exact answer of how to make sure that you can actually scale and spread, and bringing in mixed methods so that you're understanding not just what you are testing, but how you are testing it, I think is the answers to do that. And we had a very humbling experience when we took the Safe Childbirth Checklist from a very, very well-led, incredibly charismatic leader in one place in India. And then when we tried to do it in another place in India where we didn't have this charismatic leader, we realized that we actually had to change. We had to adapt what we're doing. And it was then adapted, so it is now an effective intervention, but is one that is much more locally relevant and effective. And we would have to probably go through at least some of the same process if we were to take it to a very, very different setting.
Excellent. Thank you so much, Lisa. And Kala, how can organizations develop research questions to assess the quality of their work and also to enhance their programs?
Yeah, this is a great question. Again, thank you to whoever submitted it. So I guess, this is maybe not exactly right, but I'd answer the question with a question. So what was the real genesis of the question? Often good research questions can be from qualitative or formative work in the community. Harkening back to some of the things that Michael said, if you know your collaborators and you treat them like equal partners, it'd be really great to sort of figure out exactly, where is the question coming from. And then I think this is what Lisa was talking about, developing the right methodology to actually answer that question. The techniques could range from qualitative research to quantitative research, and picking the right thing for the question that you're asking. So it's a very broad question. So I think that's sort of how I've answered it so far.
Great. Thank you so much, Kala. And Lisa, when pursuing field research, how should researchers ensure that the survey tool is culturally acceptable and appropriate? For example, many research studies developed by U.S. researchers incorporate Likert scales or true-false questions, which are forms of questions that may not be understood by the communities who will be surveyed.
So that's, again, a really excellent question. It has to go with how do we adapt what we think are good tools, and this goes beyond surveys. It really goes beyond pretty much any tool that we're going to be using. And I think the first thing to do is that you need to, again, you need to spend the time, you need to plan in advance to actually test it and to understand we generally start through focus group discussions. What do people understand about this? What do different terms mean? What is levels of understanding of, for example, Likert scales? There's different cultures where you might want to use a 1 to 8 scale versus others where you're okay using a 1 to 4, and how many of them need to be bad versus good measures. And it depends on culture of whether people are willing to give you extremes or not. So some of these are actually more well-known, and so talking to people in the field who've been doing research there, who are, again, reflecting on the great but disturbing story from Ghana, researchers already, from that country who understand that is very important. Make sure that you do a proper translation and back translation, but when you translate, again, really go into understanding what the terms mean, and that's a very important. We had a very interesting experience. We were looking at health system responsiveness and satisfaction with retention in HIV care, and we asked whether or not the clinic was convenient. And we also asked the travel time, and we had this very interesting experience where a number of people who had to travel a long distance said that the clinic location was convenient. And we were like, that doesn't make any sense. But when we went back and we really explored with some patients and with nurses, what did that convenient translation mean? It meant that it was preferable to them, and because of issues around stigma with HIV, they preferred to go to clinics that were further away, so therefore it was, quote, more convenient. So make sure that you really know what the questions are. There was a number of other questions about leading questions for surveys, so I'm going to blend into that. And again, I think, people think that making surveys is something that anybody can do. We're just asking a couple of questions. And the answer is there's really a methodology for this. And in the same way that you do methodology for other research tools, you need to actually do that as well. And I always first look for something that's already been used in that context or in a similar context. So don't reinvent the wheel. If you're reading a paper and you say, wow, that might be a tool I want to use, just email the first or the last author. They're usually delighted to send it to you and to share with you sort of some of the experiences that they have or not have. And then just make sure that you really kind of read it through, have somebody else read it through, and really just field test it to make sure that people can give you the feedback. It's the classic one I think that somebody had gave an example is, so you got good care, didn't you? Yes or no? The other thing is, even if you don't ask a leading question, be very careful about who's asking the question and where you're asking it, because you may want to make sure that people feel very free to actually give you, to essentially give you what are not socially desirable questions, because social desirability will influence, means that people are more likely to give you the response that they think that you want to hear.
Fantastic. Thank you so much, Lisa. And Kala, how can the research community improve the accepted research practices so as to discern flaws such as leading questions and improve the process?
Yes, so, taking your question, are researchers doing good work in your community, from the prior question, I would say that, one key way that you can really avoid leading questions is by rewording the question as in an open-ended way. So some of the rewording options would be things like, what type of research do you see the health workers conducting in your village? Or what health topics are most important in your community? I think the reasons why the researcher might be asking the question is really to get at this idea of community-based participatory research, so that the researcher knows that the health topic that is being addressed is really important to the rural villager that they're hoping to serve with the research. And so I think if you look at it from that perspective, you could really take out the leading aspect of the question, but retain the intent, which is that you want to ask the question in a different way, that's open-ended, and then really listen to the response. I think I can hearken to one case example in Zambia where we were testing the Writers for Health model, and we extensively pilot tested questionnaires. In fact, we went through about 13 different versions of the questionnaire to make sure that we were clear that the health workers' responses were actually what we meant to get. And, several of our research team, Sonali Rammohan, Davis Alholm, Dr. Leslie Seft, and Iran Ben David, sat with the versions of the survey and also with the responses and also with the interviewers to kind of really make sure that the version of the survey that we ended up using was, in fact, what would get the responses that we intended. The other key issue is really marrying different techniques. So you've hearkened on survey-based methodology, but I think it's also really, really important to incorporate all different methodologies in the right way. And sometimes a great place to start is qualitative or formative research to kind of get at what do those villagers or health workers really believe are the important issues. So, thank you.
Great. Thank you so much, Kala. And Juan-Carlos, how can researchers eliminate their own bias when developing a research process and then later when analyzing the collected data?
Yeah, thanks for the question, which is also another good one, that researchers bring their own bias to different phases of research, and certainly during study design and data analysis, bias can be minimized by using different approaches. I would say for the study designs, what I have seen is mostly two main types of bias that are important to minimize or eliminate. I would say first and foremost is the weak or flawed study design, which can be eliminated by having a well-defined study outcomes with a strong understanding of the program theory of that phenomenon or experiment that you want to study. And when I'm talking about program theory, that I would like to include not only what we know as the theory of change, how you expect change will happen based on a particular project, intervention, or strategy, but also the theory of action, the how you're going to bring that intervention, that approach into that context that we have been talking about. So in addition to this, I would say solid research questions developed and informed by the latest evidence about what you're trying to study should also contribute to minimize bias at the design phase. And certainly there is another one that relates to selection bias. That's another major one that happens during design phase because the use of usually different criteria for selecting the subjects that will be part of the study. So to minimize this selection bias, well-designed prospective studies should help avoid the selection bias as the outcome is unknown at the time of you want to enroll and therefore less prone to selection bias. However, for some other type of studies, maybe case control studies and retrospective studies, those will need carefully designed criteria that will be similar for all your subjects that you're going to be including in the study in order to minimize that selection bias. And when it comes to data analysis, my suggestion is to really create a data analysis plan well in advance, and similar to what the other panelists were mentioning about plan ahead, about your M&E and research studies. So get this data analysis plan well in advance at the time of study design, during the development of your research questions, before you or your enumerators go out to venture out and collect data. So this, combined with a strong study design, will significantly minimize bias during the data analysis.
Fantastic. Thank you so much, Juan-Carlos. And Liz, how do you distill and communicate complex data to prospective or current donors who may not have a technical background?
Sure. So when communicating with donors, especially those who don't have a technical background, but sort of in general, I think it's really best to present the hard data, the data as honestly as possible, but do so in a way that tells a story. So that could be one of two things. You could either actually, tell a story with your data showing kind of, some basic overview data and then go into more specifics on what that really means with other charts and graphs or indicators. But you also can literally tell a story, and I think that that's something that's really effective, especially in international development right now. It's popular, and I think it's popular for a reason, because it places the data in context of what you're talking about. And hearing so many people talk about rigorous research methodologies, it seems like a little bit like cheating to include stories when you present your data. But I think it's really important to get people to understand what you're talking about and bring it to a personal level. And we find generally that this is what donors not only want, that's what they want to hear and want to see, because they often have to go and present this information back to other people as well. And so having a story to contextualize it for people who may even be less technically savvy than them is important. And, photos and other things like that can always help. And you're not diluting the data. I think you're just supporting it. I also would just make a comment on the donor, presenting data to donors. One thing that we have focused on is we really only apply for funding with donors who have the same mission as we do. So we really look for mission alignment when we're requesting funding. And one thing that does is makes it easier on the number of indicators that we have to track. So, if we had funding coming in from every which way, then no doubt those donors would want lots of varied data. But we've been able to identify our own key indicators for our organization, and then that's what we offer up to donors. And I think that builds our own strength and our own focus, but it also simplifies that reporting process up to donors as well.
Excellent. Thank you so much, Liz. And for our final question, Michael, there are many examples of researchers who refuse to share research data or results with communities abroad where the research was conducted because they want to ensure that the results are first published. how do you suggest that they shift this mindset?
Thank you, Jennifer. Happy that this question has come up. But my personal opinion is that it doesn't matter so much where the research work is disseminated or published. After all, no matter where it's published, it can be assessed. We cannot blame the researcher all the time for refusing to share ahead the research findings with the local community before publication, because sometimes a research work, which specifically is funded by industry organizations, require that you cannot share this information. You need to hand over to the sponsors before this can be shared. And you cannot share it without prior written consent from the sponsors. So to some extent, sometimes the researcher's hands are tied behind his back, and he cannot always do that. The other way to see it is the purpose of the research. Many research works are usually directed at academic or professional progression, and this becomes an issue when it comes to having to share, because they are in a rush to publish it in order to improve their CV for their career progression. Now, the whole issue, in my view, is not changing so much the mindset of how this work is disseminated, but changing the mindset of why they select specific areas to do the research. Because by and large, if you look at it very critically, many of these works are done in areas that are economically deprived, unempowered, and all that. Because it's easy to get away with this kind of researches, and it's cheap to carry on and easy to do. Either it's expensive or risky to do in other parts of the world. So what we need to change is the general mindset of that thinking that many of these areas are a kind of unregulated laboratory facility where anyone can move in, do a research work, and get away with it. Once we're able to change this and ensure that research works that are done have local content and have local benefit, then they will be obliged to share to the benefit of the local people. So by and large, in approving research works, my thinking is that researchers must begin to align themselves to the fact that their research has local benefit. And if it does indeed have local benefit, there is a need to share it. Sharing doesn't prevent you from publishing it. It doesn't prevent you from uploading it online, but it ensures that the content of this research outcome can be implemented for local benefit and for local good. So I think it's right to say that much as they want to publish it, it must be shared. But how it's shared, I'm not too much worried about, whether it's shared before publication or it's shared after publication. But the important thing we must address is that there must be a local sharing, and the research must be available to address local needs.
Terrific. Thank you so much, Michael, and thank you to all of our phenomenal panelists and for all of the wealth of expertise they have shared with the audience today. This concludes today's webinar. Thank you so much.